Good morning. Thank you so much for being part of this webinar today. My name is Greg Hanch, and I am the Executive Director of NAMI Texas, which is the Texas affiliate of the National Alliance on Mental Illness. We have partnered with the Autism Society of Texas on this event today. We're very excited about it, very appreciative that the Autism Society invited us to co-host this event today. We'll get started in just a moment. I'm going to introduce our presenter, Abby Stevens, and just give a quick introduction here. There are a lot of genetic tests on the market, and this can be a confusing topic. So we're joined today by Abby Stevens, who is a certified genetic counselor. Abby will talk with us about pharmacogenetic or PGX testing and how it may be helpful in selecting medications for control of anxiety, ADHD, seizures, and other indications. Abby will give a background on this type of testing and help answer some common questions, which may include what is PGX testing and how does it work? Who should have PGX testing? How is the test ordered? So we invite you to be an active participant in this conversation. You can enter any questions that you have in the Q&A box, and we'll be monitoring those, and we'll make sure that Abby sees those questions that you enter into that Q&A box. So thank you for your presence today and for being prepared to engage in this conversation. I'm going to introduce Abby here. We are live in Zoom, and we're also live on Facebook. If you have a Facebook account, we would really appreciate you sharing this video. You can go to the NAMI Texas Facebook page or to the Autism Society of Texas Facebook page and share it from there to your network on Facebook. Without any further ado, I'm going to introduce Abby. Abby Stevens has been a genetic counselor since 2008 and has prior experience working at a large medical campus as a clinical pediatric GC, supervisor for graduate students, and manager of a public hotline for pregnancy exposures. She has been in her current role with Lineagen for over 6 years, where she works in a collaborative team to educate families, ordering offices, and the company's sales team on the complexities of a diagnostic genetic test. She currently resides in Indianapolis, Indiana, with her husband, 2 children, and a multitude of pets. Abby, thank you for doing this wonderful presentation for us today. We're very honored to have you with us.
Absolutely, it's my pleasure. Thank you so much, Greg, and thank you to both of your organizations for having me here today. Yeah, so without any further ado, I think we can jump right into the content. I'm going to share my screen now. Okay, I think we should be good to go. So thank you all again. I really hope the information that we discussed today that you all find helpful and informative. So let's jump right in. As Greg mentioned, the topic of today's talk is pharmacogenetic testing. And those in the industry typically just call it PGX testing. It's a lot simpler to say and easier to remember. Before we really get into the details of this testing, though, I'd like to talk to you about some background, specifically our DNA or our genetic material. And when I talk to families and providers, I always think it's helpful to remind them that our genetic material, it can basically be thought of as like the instruction manuals for our body. It tells us how to grow, how to develop, what to look like, you name it. Now, all people on Earth are expected to have lots of different genetic variation from each other. And if we didn't have these, we would be like identical carbon copies of each other. So with that in mind, much of our genetic variation are simply things that make us unique individuals. That concept makes a lot of sense when we think about how different people respond to medications. Long before any kind of genetic testing was even available, people were pretty familiar with the idea that not everyone responds in the exact same way to the exact same medications. So in this pretend good-looking group of individuals here, for example, let's say every individual was given medication A. And for this gentleman here, the medication worked great, fixed the issue, whatever that was, but he did report he seemed to get headaches, and his family was telling him he was really irritable when he took this medication. So he just wasn't sure if those side effects were really worth it for him to stay on the medicine. This other gentleman, on the other hand, reported no side effects, seemed to work great to address whatever issue it was prescribed for, and so forth. And then lastly, this young lady over here, she doesn't think the medication really did anything at all. Didn't fix the issue she was dealing with, but didn't really have any real side effects either, except maybe sleeping issues, but it was difficult to tell because she'd been stressed about other things, wasn't really sure. Now, this scenario here has long been known in the medical community that not everyone will respond the same way to the same treatment. And another way to say this is that medication itself is not one size fits all. In the general population, there are people who are what we call responders, meaning their body has responded to the medication and the intended effect of that medication is there. And there are other individuals who are non-responders. The medication has seemingly not worked or helped in the way that it was supposed to. And then lastly, there are these toxic responders, people who develop side effects or what we call adverse effects from taking the medication. And they experience things the medication is not supposed to do, but that we know can do in some people. We know that adverse effects, otherwise called adverse drug reactions or ADRs, these can be a real problem. Within the United States alone, there are many estimates of the impact that adverse reactions have had. You can find a lot of different numbers out there, and that's likely because ADRs can be really difficult to properly identify and properly track for their effects. But we know that the impact and management of them is very complex. And according to the FDA, which is where this information is taken, there may very well be up to 2.2 million adverse drug reactions a year in very severe scenarios, sometimes even resulting in deaths. And all of this may cost in the range of $30 to $130 billion annually in healthcare costs, essentially. But why does this all happen? Well, we know medications are prescribed a lot, and medications are often prescribed together a lot, and we don't always understand the effects that they have on each other as well. And this is where essentially PGX testing can come into play. This testing is considered one tool in your healthcare provider's toolbox, which is to say that any doctor or practitioner who is prescribing medication is always taking lots of different things into consideration. Like, what is this person's history with other types of medications or other medications in the same class? Is there a family history of severe or significant reactions? Simple things like, what's the person's height and weight? And also, are there known environmental or even dietary factors that could influence this specific medication? There are or should be a lot of things to consider when prescribing a given medication. PGX testing is one tool, we say, that can be used to provide some additional information to consider while making all of these decisions around the use of medications. This means that PGX testing will not provide a black and white roadmap of what medications to use, when to use, and how much to use necessarily. Rather, it can provide some additional information for your doctor to take into consideration. But first things first, how does it even work logistically? Most often a doctor needs to order this test, and there's very few exceptions to that. So you could talk to any licensed practitioner, okay? So depending on states who can order, this could even be a nurse practitioner, psychiatrist, other individuals as well, but licensed practitioners, you could talk to them about the usefulness of this test. And then to do the testing, some kind of biological sample is needed, right? And most labs can use a cheek swab with no blood needed. And if you definitely want to avoid a blood draw, make sure the test that the doctor your orders is done on a swab, because those are readily available. Now, once swab results usually comes back fairly quickly for genetic testing, especially in about 2 to 4 weeks. And most importantly, the results should be talked about with your doctor, and we should never ever stop or change a medication that we're currently taking without talking to your doctor or your medical provider first. Now, to talk about PGX in more detail, though, about the testing itself, we first need to talk about common types of genetic tests, which can very broadly be placed into 2 main categories. And those would be diagnostic tests and recreational tests. So diagnostic tests are used to try and find the root cause of a person's symptoms. These tests have to be performed in laboratories that meet very certain and stringent criteria. And the results of these tests, very importantly, can be used directly to make medical decisions. So in short, these tests can actually diagnose genetic conditions. And a common example of this in the pediatric realm, especially for individuals with autism spectrum disorder, learning disabilities, developmental delays, this is going to be a CMA test, or chromosomal microarray. Current pediatric medical guidelines all recommend CMA testing for any individual, including children or adults who have those diagnoses that I previously mentioned. Now, on the other hand, there's also recreational forms of genetic testing, what we kind of call testing that's done for fun, essentially. So these tests are using your genetic material and looking at it for markers that have been associated with certain traits in people. Things like whether cilantro tastes good or not to you, whether your face flushes significantly when you drink alcohol. And these tests can also look for markers identified to be more common in certain ethnic or ancestral populations. So they can estimate whether you have some roots or ties to African populations versus German versus Hispanic. Importantly, though, results from these types of tests typically cannot be used to make medical decisions. That's because not only is the testing itself usually not verified in the same way as diagnostic testing, but also because the type of information it tends to give is not used for medical purposes. So even things like risk estimates for type 2 diabetes. The testing itself is not diagnosing type 2 diabetes. It's simply making a guess as to how likely you would be to develop diabetes. But we know that we can do things to change those estimates, like changing our diet and exercising, things like that. So where does PGX testing fall in all of this? Well, it's kind of on its own. It is not recreational testing, okay, by any form of the word. In the medical field, though, we tend to not necessarily call it diagnostic testing either. Sometimes we use terms like predictive testing or maybe diagnostic risk testing. And the trouble with the terminology isn't really important, but it does have to do with the fact that this test is not diagnosing a genetic condition per se. However, it is identifying genetic changes that have been associated with how a body breaks down medications. So how does it do this? Well, it looks at our genetic material. And for a quick biology review, you may recall that our bodies are made up of billions of cells. Inside each cell is a complete set of our chromosomes, which are basically like the tight packages of our genetic material. And one piece of DNA, or our genetic material, that tells the body to do one thing in particular, that is essentially a gene. So a gene is one specific instruction to the body. PGX testing looks at a small list of genes that specifically code for enzymes. Enzymes that help to break down or metabolize medications in our body. So just briefly summarize, genes make enzymes and enzymes work in our body to metabolize medications. And enzymes essentially work in two main ways, depending on what form a medication is given. Many medications enter our body in the active form, meaning they're ready to do their job, take care of whatever symptoms it is that we're dealing with. At that point, it's an enzyme then that will work on that active medicine to break it down into a non-active form that we can excrete and get rid of. This is why we have to take medicine, every so many hours or each day, because once we take a medicine, it can only work for a certain amount of time before our bodies break it down and get rid of it. Now, depending on how well that enzyme is working, a person may get rid of this medication faster or slower. Now, the second main scenario that could occur is that the medication that we are given is actually given in an inactive form. So at this point, then it's an enzyme that comes and works to turn it on, to turn it into that active form that can help alleviate our symptoms. So depending on how well this type of enzyme works, a person may not get enough of the active form of the medication, or they might get too much too fast. PGX testing usually reports on both types of these enzymes with interpretations as to what effect it may have. PGX is actually looking at how these certain enzymes may work by looking at the genes for these enzymes. Remember, the genes are coding for these enzymes. And we know that these genes can be quote unquote spelled out in a person's body in different ways. So this means that a lot of people out there in the general population might have a gene coding an enzyme spelled with, say, an A, while another group of people have it spelled with a G. And depending on which spelling a person has, this may influence how that enzyme works. And this is how we talk about the enzymes in a PGX report with this kind of terminology. Each gene, depending on that person's spelling, may mean that they are expected to make a form of the enzyme that equates to a poor metabolizer, intermediate, normal, rapid, or ultra rapid metabolizer. And I think this visual is really helpful here because it's showing you that on either extreme end, both a poor metabolizer and an ultra rapid metabolizer, both of those can have some kind of implication when when taking certain medications. All of that being said, let's take a look at what you could actually see from a PGX report, the results themselves. Now, generally speaking, most PGX providers will provide you with results that categorize medications into three broad categories. And they categorize these medications based on which enzyme mostly works on that medication, and then what your specific results were for that enzyme. The three categories are essentially a red, yellow, green grouping. A lot of PGX labs will do this. Those with major prescribing considerations, so major prescribing concerns based on your specific genotype meaning your specific spelling of that gene and enzyme. The next would be minor prescribing considerations. And then lastly, green would be usual or typical prescribing considerations, what some might say use as directed. So let's look now at one such sample report. And this is not a Lineagen report where I am currently employed, but this is a competitor report that can be found easily online. And you can see in this image that they, of course, use that red, yellow, green categorization system. And this part of the report is specifically for medications considered to be antidepressants. So they have separated out this group of medications to then tell you which ones in that group are red, yellow, or green. Okay. They also give general descriptions for the categories, stating that the medications in red are likely to require dose adjustments, they may be less likely to work, or they may cause side effects. For the yellow, it's essentially the same, but without mention of side effects. And for the green, use as directed, meaning the results did not show any known genetic issues that would be expected to alter patient response. And in just a minute or so, I'm going to talk more about this green category specifically, because it's sometimes a bit confusing as to what it truly means, in my opinion. First, though, let's take a look at an example from a Lineagen report. Okay, and this is an example of a medication that's in the red category, a very common medication, ibuprofen or Motrin. Okay, this individual's spelling, their genotype of the CYP2C9 gene. Okay, that's one gene and enzyme that is very commonly assessed for. Their specific genotype means that they are expected to be a poor metabolizer. And for ibuprofen specifically, this means that the enzyme will not break down ibuprofen to clear it out of the body as quickly as it typically should. So this means a person's exposure to ibuprofen is longer than usual, and that could cause side effects like bleeding in the gastrointestinal system. And because of this, there are guidelines from an international group that is recognized as the experts in PGX. This group is called CPIC. Okay, it's an acronym, stands for Long-Term Clinical Pharmacogenetics Implementation Consortium. We can stick to CPIC, okay? And CPIC has information regarding their guidelines online, and we will summarize it in our report here. And this is something that might be fairly unique to Lineagen. Our reports can be very long, sometimes 12, 15, 18, 21 pages. And this is because we include information like this next to every medication that is in the red category. We do this because we think it's really important to give as much information as possible, as much useful information for the doctors and families to see. And then we also have an extensive list of references so that the doctor can look at each of these guidelines in more detail, look up directly where they are taken from, and review that full discussion around it. And here's an example for the yellow category, which for us at Lineagen tends to look a little bit more orange, but I think you can get the picture here. The example medication this time is for atomoxetine, which is a generic name for Strattera, a medication commonly prescribed for individuals with ADHD. And based on this individual's genotype, their spelling of this enzyme, okay, this person might have an inadequate response, what some might also call a therapeutic failure for atomoxetine. And again, you can see a guideline from CPEC relating to this here for the doctor to reference and get all of that more detailed information next to it. And then lastly, here is a list of some medications in a green category. Most of what you see here that I took from a sample report are tricyclic antidepressants, largely metabolized by the CYP2D6 and CYP2C19 enzymes. So just the names of some common enzymes that are looked at on most PGX testing. Based on this individual's genotype, there is no known effect correlated to the use of these medications specifically. Now, as I mentioned a few minutes ago, this green category is what can actually be the most confusing sometimes when I talk to families and providers. And here's why I think that is. Just because a medication is in the green category, it does not automatically mean that this medication will work great for this individual. Another way we could say that is a medication in green means the test did not identify any specific genetic risk factors when using this medicine, but typical prescribing considerations should still apply, which means all of the usual factors a doctor needs to consider when prescribing these medications, those are all still there because we know the human body is really, really complex. And knowing this person's genotype is just one piece to their puzzle. Now, here's a smattering of things that ordering providers should always be taking into consideration when prescribing a medication. Things like age. Do they have any other underlying diseases or health conditions, and so on. A medication in a person's green category of results means that all of these things still need to be considered, but genetically speaking, there's nothing here that they need to be aware of. So let's run through an example of how this could play out in real life. Let's say there's a little boy named John, 9 years old, and he was diagnosed with ADHD a few years back. And parents have been trying to manage the ADHD symptoms with some diet changes, therapies, and coping techniques, but they've come to a point where not only is John's academic work being significantly impacted, but their home life as a family is as well. So they go to Dr. Smith, let's say, who suggests starting on a medication, preferably a non-stimulant ADHD medication to try first. And Dr. Smith spends some time talking to the family about this trial and error process that many children have to go through to find the right medication that works for them. He tries to prepare them that this can be a stressful process, not necessarily dangerous, but the family should be prepared to see their child perhaps experiencing side effects or having to try multiple medications before they find the right one that really works best for John. So as part of this discussion, Dr. Smith brings up PGX testing, explaining that the test will not tell her right off the bat what is going to be John's perfect medication, but it could help to give her a heads up to some medications that they may not want to try first. Or it may give her some guidelines regarding atomoxetine, which she typically would recommend trying first in a scenario like John's. John's family decides that they can afford the testing and they would like to give Dr. Smith as much information as possible before starting a medication. So they do the testing and John's results come back and shows that he is a normal metabolizer for CYP2D6, known to be a very big main player in the metabolism of a lot of medications, including atomoxetine. So atomoxetine is actually a bit unusual though. If you remember, this was our example from our sample report as well. CYP2D6 normal metabolizers are actually known to not achieve as great an effect from atomoxetine in particular, and it has to do with specifically to this medication and how it interacts with CYP2D6. So usually normal metabolizers may not respond as well to the medication, or they may need a higher dosage. And there has been published guidelines from both CPIC and the FDA on how to address this situation. So at that point, Dr. Smith can pull this information and they would find some info laid out like this with a full discussion for the doctor to follow. It explains what the scenario is and how to adjust or monitor dosing to accommodate it. And I think now is a really good time to point out as well that this medication, atomoxetine, was in John's yellow category, but this does not automatically mean that John shouldn't ever take it, okay? Similarly, many medications, even in a person's red category, may still be viable options for them in their treatment. But, okay, and it's a big but, the red category means that the doctor needs to know something about that medicine, needs to review this additional information so that they understand what this particular individual is at risk for, and if there are any guidelines as to how to address it, if they feel that red medication is truly needed. So in this way, PGX testing is giving information on potential risks associated with medications. It will not tell a doctor what to use, but it can help to guide their decisions on what to use. And now that we've talked about what PGX testing is and what results look like, who is this test really intended for? Who should have the test? And in theory, I think someone could argue that anyone who's taking a medication or may be prescribed a medication, that any of those individuals could potentially benefit from having it done, because it may tell them something about risk for side effects or considerations for dosing changes, things like that. PGX tests can often comment on many different types of medications that are used for many different purposes. So most all PGX testing will be able to comment on some medications within each of these classes of medications. So anti-ADHD medications, anti-seizure, antipsychotics, anti-anxiety, depression, medications to help lower cholesterol or blood pressure, opioids, and some pain medications. So for individuals undergoing surgeries, and we know that this may be an issue, this may provide additional information. And even some very common medications like ibuprofen that we discussed before, as well as medications for reflux, gastroesophageal reflux, and allergy meds, antihistamines. So no matter what reason a person undergoes PGX testing, though, it's really important to use these results with your doctor or prescribing provider. I mentioned this toward the beginning, but no one should ever stop or change their medication without first consulting their doctor. And this is because, as we've discussed, this testing is not a crystal ball for what to do, how to do it, and when. Humans are just much more complicated than that. PGX test results have information that a doctor can take into consideration. And for some people, this may be hugely helpful. For others, depending on their specific genotypes or their specific results, it may not give that much more additional information. So, at this point, I think it would be reasonable if some of you were wondering, I don't really know what to think of this testing. It seems like it could be really useful, but maybe not. And if that's where your head is at right now, you are not alone. Commentary surrounding PGX testing is variable. So two major medical organizations, the American Academy of Pediatrics and the American College of Medical Genetics, so two large groups that help to put out protocols and guidelines for medical management of individuals, they have statements saying, yes, PGX testing is acceptable, of course, with permission from the parents. Hopefully that was a given, but we often need to state things like that. Now, on the other hand, the American Academy of Child and Adolescent Psychiatry, they're not as big of fans at this point, suggesting that perhaps clinicians avoid using it, specifically in regard to psychotropic medications in children. And they consider it to perhaps just have limited usefulness, limited utility, and it just may not be worth it overall. And while bringing up that topic of limitations, let's touch on that a little bit more. Now, the first one here, I think we've discussed, though PGX can give information on medication usage, it also may not. And so it is not that crystal clear ball to tell us exactly what to do. Okay. And here's the other thing in regard to that. Our interpretation may change over time. Okay, as the genetics and pharmacological communities continue to learn more and more about our genes and enzymes and their relationship to medication metabolism, our knowledge of a person's PGX results and its implication for medications is also going to continue to evolve. Now, number 2, interpretation may be more challenging in children. This is due to some developmental changes in gene expression that can be going on as a child grows and develops, as well as like their physiological changes that can impact a number of things, like how a medication is absorbed or transported or excreted out of their bodies. Number 3, the usefulness of this test, unfortunately, may be lower in minority populations. Similar to a lot of genetics research at this time, much of the research conducted on PGX has been with individuals of European ancestry. And so therefore, there are more limited data for minority populations. Even though we know that genotypes or spelling differences, the prevalence of those can be different in different ethnic groups. Now, number 4, depending on the test performed, it may be more limited in the scope of what all gene spellings or genotypes it is looking at. Okay, if it's only looking for the most common gene spellings or genotypes, some rare variants may not be identified in those rare individuals who have them, which then means that their results and the interpretation may not be as specific to their body. And lastly, number 5, there are many doctors or providers who simply haven't had much training or education on how to use these tests and their results. They're fairly new and just beginning to be regularly incorporated into some practices. So that can sometimes put you as the patient in a bit of a conundrum, okay? And I think it's really important, if you do pursue PGX testing, to select a lab that offers services to speak directly to you and your physicians about the results in order to help guide and direct you to put these into appropriate context. I can't speak for other labs, but I can tell you that for PGX testing done here through Lineagen, you would have direct access to talk to myself or another genetic counselor about your results. Now, in no way do I want you to think Lineagen is the only PGX provider out there, however. There are many, probably many more than what I even have listed here. If you or your family is considering PGX testing, I would encourage you to first talk to your doctors, okay? They may already have experience using a certain lab that they prefer and be able to explain to you why they use them in particular, what they like about it. If your doctor is not familiar with PGX, engage with them, in a research process to identify what lab could be most beneficial. And part of that process for sure is to check and see if the medications that you are actually interested in can actually be commented on in the report. Meaning, if you are interested in taking medication A, make sure medication A has any currently known correlation to a known genotype or enzyme right now that is tested and reported on. Nowhere near all medications in the world right now can be commented on in a PGX report. Most we simply don't know to be correlated to a specific gene or genotype at this moment in time, though our knowledge of things like this will absolutely continue to grow over the years. Now, even though there are a lot of labs out there doing PGX, the cost I have found doesn't seem to drastically differ. Most tend to hover right around $300. I think some of the cheapest one I found was around $250. some more like $350 to $400, $450. At Lineagen, our PGX test is $300, and we do not currently accept insurance. It is a self-pay test only. And this is another point of variability. Other labs may try to work with insurance, but it can be very hit or miss whether there is coverage or not. And so I would say it is not uncommon to have to pay out of pocket for this testing. And my last piece of advice, PGX testing is not currently standard of care, essentially, which means there often is not a right or wrong answer when it comes to whether you should or should not do this test. So please talk to your doctors and healthcare providers and do what is best for you. Thank you so much.
Thank you, Abby. Thank you for the wonderful presentation. I don't see that any questions have been submitted. If there are any questions, last minute questions, please feel free to enter those into the Q&A box. We'll give about 30 seconds for any questions for Abby. But in the meantime, I want to thank Abby for educating us about PGX testing. And I want to thank the audience, both here in Zoom webinar, as well as the sizable audience on Facebook who took the time out of their day to learn about this great resource. Someone's asking for a copy of the presentation in chat. There will be a recording available of this, and we'll make sure that gets distributed to the webinar attendees. Abby, anything on that?
Yeah, I think we could likely provide a PDF copy of some of these resources if there's interest there. Okay,
excellent. Sounds good. We'll include that in the follow-up materials if it's available. I see something in the Q&A. Abby, the question reads, do most doctors accept these tests as accurate/reliable?
Yeah, that's a really good question. And as I kind of alluded to toward the end here in the risk and limitation section, I think you'll find that provider outlook on these tests is highly variable. We have physician groups that use this regularly for all of their patients for a wide variety of indications. We have other physician groups who have never ordered it before, are very unfamiliar with it at all. And so I would say just about anything under the sun is possible when you start engaging in these conversations with your providers. When it comes to the topic of accuracy, though, in particular, that word that you used, accuracy would imply, are the genotypes, those spelling of the genes that we're identifying, are those accurate? Are those true? You should have no reason to doubt what those actual results are. So the genetic testing technology itself, absolutely, that's going to be true. Where more of the question and limitation comes in is the question sometimes is, at this point in time, December 2021, do we really have the full knowledge of this genotype, though, in how it relates to how we take medications? And what you'll see is that there are some laboratories out there whose testing appears to be more comprehensive, meaning there's a lot more genes they test for, a lot more medications they comment on. And there's other labs, I will say Lineagen is one of them, with a pretty defined smaller list. And that kind of addresses that concern. There are labs that have taken more conservative approaches or more liberal approaches into what kind of information we will distribute. Here at Lineagen, our test panel is fairly, I would say it's average to small compared to competitors. And it's because as a lab, we've basically chosen to make sure that any information we're providing meets a very high evidence level, such that even as more information continues to be grown and we learn more and more, we are still confident that the correlations and the studies that have been done thus far have firmly established a link between medication response and the genotypes that we're testing for.
Great, thank you for that response. There's another question just entered into Q&A. Do insurance companies consider these tests experimental or lacking in evidence-based medicine? Is this why they don't pay for the tests?
Yeah, so I don't think I could comment directly on what each insurance company's actual rationale has been. I have heard there are some policies out there that have covered it in various places, but because by and large there is very little reimbursement in the field in general, labs such as ours, as well as many others out there, have gone directly to as low as possible self-pay costs that we can, meaning we don't even offer to check with insurance. We just say, we have this test, but it's $300. You have to pay for it directly, or I'm sorry, we can't run it.
Thank you. I'm not seeing any additional questions. So thank you again, Abby, for this presentation, and thank you to our audience. I'd like to encourage anyone watching either in Zoom or on Facebook or who sees this recording to look at the resources that are available to you through Autism Society of Texas. You can visit texasautismsociety.org. They are one of the leading voices, if not the leading voice, on autism in the state of Texas. And on the mental health side, please consider availing yourself of resources made available through NAMI Texas, and you can find those at namitexas.org. And finally, Abby's company is Lineagen, and you can find them at Lineagen, LINEAGEN.com. Thank you very much for being part of this event. And once again, thank you, Abby, for this wonderful information.
My pleasure. Thank you all so much.